All right, y'all, welcome back to Level the Playing Field. More topics on sports medicine. Now, as y'all know, we talk a lot about arthroscopic surgery in sports medicine. I'm about to show y'all what a scope is and how it goes down. So like and subscribe. Keep following to learn more. So arthroscopic surgery is minimally invasive surgery that we do a lot of sports medicine techniques with. And that's to decrease our recovery time because we're using little small incisions and working with these tiny little cameras. So I'm gonna show you what that looks like. This is actually what an arthroscope or a scope looks like. And what it is a lens that's attached to a camera base. And it almost has kind of a periscope like on a submarine, where it's not looking straight on, it's looking at an angle. And I can actually rotate this around to look around different angles when I'm working. And so that's critical to being able to use these minimally invasive techniques to master the arthroscope. And a lot of time goes into that in residency and in fellowship, okay? So this arthroscope is inserted into the joint that we're working on. So let's pretend that this here is a knee. So we introduce it into the knee. And inside we have a few practice pegs. Now this is what I call shooting free throws. I practice this on a regular just to make sure my skills are up. One of the biggest skills when it comes to arthroscopic surgery is what we call triangulation. And that's the ability to use your three-dimensional sense to find yourself inside the joint. So from two different locations, I got the camera on one hand and I'm putting the instrument in from the other hand. And I can find myself through triangulation. And that's something that takes years of practice to get it down. So as you can see, this is kind of like a video game, almost like a first person. I'm moving around, I can move the camera angle anywhere I need to, I can see everything I need to. And imagine you're inside of a joint, a knee or a hip or a shoulder. You use this camera to move around and be your eyes as you're working. So generally I use my left hand, if I'm doing a right knee to hold the camera, and my right hand is working on the instrument and vice versa. But it may vary by the surgeon and by the patient. So this is an example of something that, a lot of times we're in residency, we'll actually practice working on something like this to increase our skills in kind of a low stress environment. So we're not always working on a patient where we're learning how to do things. And I think that's very important to focus on things like simulation to get good at it. So I got my camera in place, you can see that. Bring my instrument in, I'm using what's called triangulation to find myself. And there I am. And then we start to work in. People who say video games don't amount to nothing, they don't know anything about arthroscopic surgery, because playing video games definitely helps getting a bit better at this. And so the key is remembering that everything is just small little movements when we're working this. So we're taking our time, we're finding our angles, we can use our camera to get a closer look to see what I want to do. I can get myself right in position. And we can just work on this as much as we need to get those skills down. The name of the game with arthroscopic surgery is remembering that the camera is your friend. It's your eyes inside the joint. Oh, I dropped one. I only get one drop per video. Remembering that the camera is your eyes inside of the joint. So some people will kind of get into the habit of just keeping the camera in one place and just trying to work. But it's important that you really zoom in and get a real good look at what you want to see. So if I really want to see that peg that I'm aiming for, I move over here and I find that piece. Get up on it real close so I can see my angles. I can follow myself right over and put that thing back in place just like I need to. I get the perfect angle and push in. Right, and these are all skills that we use when we're doing arthroscopic surgery. So one of the most basic arthroscopic surgeries you can do is removal of a loose body. When someone has maybe a piece of cartilage or a piece of bone inside of a joint that's floating around and causing trouble. And this is literally the same skill set. Once you get inside the joint with your camera, with your instrument, you go find that piece, you get yourself a good eyes on it, you get it with your instrument, and you either take it out or put it where it needs to be. So me personally, I try to work on this at least once a day, just to keep my skills sharp. Like I said, I call them free throws. And I try to make it harder on myself every time I do it. So, I might, do it standing on one leg, I might do it, using a metronome to kind of speed up the process. With a metronome, I'll try to keep everything in rhythm, right? And I'll, slowly over the course of time, increase the speed that I'm doing it at, and that forces me to get faster every time. And I think it's key to remember that us as surgeons, what we do is a very physical profession. Anything that physical requires practice and maintenance of skills. And it's absolutely critical that you make that part of your skills. So for me, I take that part very seriously as a maintenance of skills. So like I said, all y'all who are playing video games, at a young age, you may consider, a career in orthopedic arthroscopic surgery, because a lot of the same skills apply. Understanding how to move the camera to see what you want to see, remembering that the camera is a separate entity from your working, is all important stuff. Let's get this last one on there. So of course, this is a real basic activity. This does not in any way, represent the complexity of performing an orthopedic surgery. But what I will say is the basic tools and foundation this lays is important for what you do next. So whether you're doing an ACL surgery, a labral repair in the hip or the shoulder, a rotator cuff repair, all of these are minimally invasive arthroscopic surgeries that we're doing through these same techniques. And the same things apply. Controlling the camera to get an excellent view, triangulation so we can find ourselves within the joint, and then taking our time. All these are very small, tiny movements. This camera magnifies everything. So if you were to see these little pegs I'm messing with outside of the scope, you would see they're like a couple millimeters in size, but they look huge inside the camera. And that's really important when we're working on little small detailed things, like for instance a meniscus inside of a knee. Not particularly big on the outside, but when inside the knee joint, we get a nice big view of it, and we can see all the complexities of the anatomy, so we can make sure that we're doing things properly, make sure we're fixing things accordingly. All right, I'm gonna do 2 more here, and we'll wrap it up. So again, getting a close view on it, really getting my eyes and my angle looking at it. Now, one key point I would point out to you is that, remember I said this is kind of like a periscope on like a submarine. So you see where the arrow is looking? That arrow is showing me where I'm pointing with my camera. So this is a 30-degree arthroscope, meaning it looks 30 degrees away from straight on. So wherever my arrow is pointing, it is looking 30 degrees in that direction. Now that's the most commonly used scope for arthroscopic surgery, is 30 degrees. There are other scopes too. There are straight up 0-degree scopes. We don't use that very often. There's also 70-degree scopes, and those play a role a lot in, for instance, like hip arthroscopy, or sometimes even when performing an ACL or a rotator cuff, we'll use a 70-degree scope. And the idea is that large degree gives us more of a kind of look around the corner, so we can see kind of a wider view. This last one's trying to get away from me, man. We're gonna catch it though. There it goes. And again, try to get our good view on there, place it in place. Push it in, real tiny, fine movements, and there it goes. Arthroscopic surgery, the basics at the very least. So what we take away from this, arthroscopic surgery, or scopes, knee scopes, shoulder scopes, hip scopes, involve using a small camera to look inside a joint to do the work. The skills very much relate to what someone does playing a video game, in though you're moving the camera around to get your view. You're making very fine, small movements with your other hand. And so being able to balance looking at using two hands to work rather, while watching a screen to perform activities. These are skills that really take years and years to develop. But now that you see the basics, you can see what goes into performing sports medicine, and perhaps one day do it yourself. So this is Level the Playing Field. We'll see you next time. Please like and subscribe for more content just like this. Take care.